topic we discussed on Tuesday, which has to do with dead bodies and in the context of the COVID-19 situation we have. So I'll just be briefly walking you through two basic pieces of information that were out there. One is the infographic that we publish routinely after 3 p.m. every day. We had, if you notice, looked at the two different infographics that were published on Tuesday and Wednesday, and there was not a change in terms of the number of people tested. And the reason why we have to explain it is because it doesn't mean the only thing that changed from that infographic is the persons under investigation. If you notice, the numbers went up from Tuesday to Wednesday. All that means is that whenever we publish the data, it extracts it from an Excel file that is updated, and we have a cutoff time of 3 p.m. and I think we had agreed and we had shared that specific time. So whatever test result is out by 3 p.m., that's when the infographic will be cut off, and that's the information that's shared. So what has happened is from Tuesday 3 p.m. to Wednesday 3 p.m., no results had been put up in the system, and that's the reason why you did not see any change. It doesn't mean that the lab has stopped working. It just means that the lab may be processing samples, extraction, and depending on when the samples are coming in from the different areas. So that's the reason why when we had a cutoff time yesterday, you did not get any updated test results. I can tell you right now, I don't know how many samples were run yesterday, but after 5 p.m. those results were out, and all of those are negative and will be reflected in a report that should come out after 3 p.m. today. That's in terms of the infographic. One other piece of information that you should be seeing change is because it does not mean the total number of people tested, because some people have been tested more than once. So it should really be reflecting the total amount of tests done. So we're going to make that change in the infographic for later on today. That is one, and the other situation is an internal memo that was circulating late yesterday. I actually wasn't aware that it was circulated. There's no problem with it being circulated because memos that are sent to staff are public documents. There's nothing to hide in that regard. But just to clarify that memo, if you go through it, it's referring to the private practice that's being done within the public health system. So that internal memo is addressed from my desk to the regional management teams, and I can perhaps just walk you through what a regional management team is and who that memo was intended or is intended to be for, so that we can have a little bit of clarification versus what was socialized on social media yesterday, because I think it was obviously misinterpreted, whether on purpose or for whatever other reason. But that memo basically sent to the regional management teams. Every region, as you know, we have 4 health regions. Northern Health Region, which deals with Corozal and Orange Walk. Central Health Region is the Belize District and outlying Keys. Western Health Region is Cayo District, and Southern Health Region is Tan Creek and Toledo districts. Each management team is made up of a regional manager, a deputy regional manager. Each of the regional and community hospitals has a chief of staff who is the lead doctor per facility, and a lead nurse in each of those facilities. So once that memo is sent, that is a team that would routinely be getting that memo. All that memo was saying is, if you notice, is specifically talking about private practice for people who are employed within the government system. That memo makes no reference to private practitioners outside of the government service, and it doesn't even make reference to Carl staff, which is governed, as you know, by a board of governors under a specific authority. So that memo did not even go to Carl because that's not the intended or targeted audience. So that memo was an internal memo for these regional management teams. And all the memo is trying to highlight or is stressing is something that has been discussed with the different management teams. The last time this was discussed was on Good Friday when we had a virtual meeting, so the teams were aware. All we are asking in the memo is that people who are employed as permanently established staff in the government system, that they should refrain for the time being from engaging in private practice And that simply is a means of trying to safeguard the service that they give and the human resource element. Because as you would note, in at least 3 instances of the 18 confirmed cases that we have, these patients were seen by doctors in the private sector first before they came into the public sector, and usually by doctors or health staff that works in both public and private. So the memo was highlighting the fact that if an officer is exposed in the private setting and is then asked to be under quarantine for 21 days, you understand that that can potentially cause issues in terms of the human resource and the health system that we have, because you know that we don't have the human resource element, which is a growing concern everywhere. So all the memo was asking is, and reminding them, because it had been asked of them already, is in terms of the COVID-19 pandemic, if they could curtail whatever was being done in private practice, and if they got exposed and were placed in quarantine while they were in private sector, then that we could not possibly as a health system be paying, if you will, for the time that they were away from their work. That's all the memo intended to say, and that's something that had been a part of an internal discussion. At no point in time was that memo intended for anybody else outside of that context. Even contract officers, what you would have to do is review people who are employed on a contract. You would have to look at the specifics of what your contract says and then be guided by the working conditions of your contract. Those are the 2 things I wanted to clarify. One other note is that I did speak briefly this morning with the president of the BMDA, Dr. Mughel, not necessarily to adjust the press release, but to ensure that we continue to be engaged, because we have one common ground on which we need to part, and that's COVID-19. And expressing the support of my desk to ensure that CME, continuous medical education, is provided to medical doctors across the country, and that we would provide the Zoom platform for it to be used so that people across the country would have access to any educational sessions that we have, and trying to see if we can get some of the doctors to get some credit from the ongoing sessions that we have. As you would recall from last week's sessions, we had mentioned that in tandem with a team of doctors led by Dr. Hidalgo, we had a virtual platform where we are giving a 1-hour sessions 2 to 3 p.m. every day, and there's a 14-day training program for medical officers across the country. So that discussion happened already. And one final thing before I go is that yesterday with PAHO, and this is PAHO, all countries in the region were invited to a session, Ministers of Health and Ministries of Health, to discuss the same topics that we have been discussing, the issue of social distancing and when is the optimal time for relaxing such measures. I think some of the measures that we have implemented are starting to show, where at least we are not seeing any more positive cases. So this element of when you relax social distancing measures, if we ever do, is something that we are reviewing internally as a team, because even when we start to lift up some of the lockdown businesses, then you would understand that it won't be business as usual. It's going to be a gradual process, and we'll be able to say how we go about doing this as a community. We also got an overview of the current status of rapid test kits and other diagnostics. The key document that was shared in terms of this topic clearly indicates one thing that I need to reemphasize. The gold standard for making diagnosis of SARS-CoV-2 remains PCR testing, which is what we are doing at our central medical lab. While everybody is on the lookout for rapid testing or other platforms other than PCR, the meeting yesterday was clear in that those have not been validated, at least not for the Belize context. So until that happens, PCR testing remains the gold standard for diagnostics. We had also a brief discussion in terms of chloroquine and its use. And again, there's, the evidence that is just starting to come out, where some saying it's should be used, some entities are saying that there is no overarching benefit in the use, so that's a topic that's still up for debate. And as the science comes along, we'll be reviewing our guidelines in that regard. There was a brief discussion of the use of masks in the general population, and the other aspects that, of course, start to come down when you have lockdowns, the social, economic implications of lockdowns beyond just the health sector. So those are my elements I wanted to address with you. We don't have any new positive case that we have identified, and over the last 24 to 36 hours, I think our phones have started to come down in terms of the amount of people that are symptomatic for the flu, but this also falls in line with what we routinely would find every year. The flu season routinely ends towards the end of March, but remember, in our case, we're looking specifically for COVID-19. I'll go through some of those questions and then I'll go. It says positive individuals listed as positive. We don't have any recovered patient. So once that is recovered, we are going to put that up for in our infographic. We don't have no recovered patient as of today. Are the individuals coming forward from the party to be tested? Gradually, we started to get those trickling in, and some people are referring others for that testing situation. Up to yesterday, we had a very small amount of samples. That's one of the reasons why we had not run a specific cycle, because you wanted to get all the potential cases or investigation in one single batch going in. Can the infographic show both the number of people tested as well as the number of tests conducted? I think that's something we are looking at. One of the issues is, I know people keep asking us for more data in terms of the infographics, but you also don't want to put too much information that the information is lost in the infographic. But at least for now, we are considering putting number of tests conducted. The mapping of patients find out who infected him with the virus? No, we have not been able to ascertain that. Docs at private clinics will not be able to treat at Karl Huchner. I think that's a question that we will have to ask Karl Huchner to address. As I said, my desk doesn't routinely go through the process of employment of staff at Karl Huchner. The memo I sent was specifically for permanently established staff within the public sector. How many tests will your office recommend we buy from Cayman? I know that there's discussion between the two lab directors, because the tests from Cayman, even though they are compatible, also require extraction enzymes, which we have not procured. We are procuring enzymes for the current PCR test that we have. Since they're the same ones from South Korea, how do they differ? Well, it doesn't mean that because they come from the same country that they are the same kits. There can be many things in that regard. And I think that's the final question for me. When will students be able to return to school? The short answer is we don't know. Up until next week, next weekend, next 8 to 10 days is when we start looking at the numbers and see whether we can make that recommendation, and also follow what other countries are doing in terms of opening up. At yesterday's meeting with PAHO, some of the Spanish colleagues from Spain were sharing some of how they have gone on with eventual opening up of facilities, and they themselves acknowledge that they don't know when is the ideal time to open, so that countries will have to make individual decisions of how you go about opening it. If you ever go back to a normal school calendar, then, because it might be that your school classrooms are spaced out, that you come in one day for the week. Many dynamics are going to have to be addressed, and we are learning as we go along. How does the Act of Defense Production in the U.S. invoked some weeks ago, production and selling of ventilators and PPEs? Well, we are trying to use different mechanisms to get them here, and wherever possible, we are rerouting them so it doesn't have to go through the U.S. before it gets here. We don't only procure from the U.S. Is testing being ramped up in the other districts such as Orange Walk and Stan Creek? Yeah, and maybe even we have a little table, because I know that in the infographic you look at total numbers, but I had said on Tuesday's activity that we do look for rates, because even if you have a specific number for Toledo and a number that looks much higher for Belize district, when you look at rate, it might be the same rate of testing that you are doing. So we should not really just be comparing numbers. We need to be looking at rates. How true is it that COVID-19 affects the central nervous system? It has been reported. There's a recent document that says that it can potentially affect central nervous system, as with other flu situations. Are we relying on the mapping to identify symptomatic carriers, or do we plan to do some form of random testing to help with that? Both elements of that have happened. We have done random testing with frontline workers, even doctors and frontline staff that may have been potentially exposed. No recovered patients, but how are they doing? They're doing fairly good. You would have seen a little video that we shared yesterday, and I think we need to share the success stories. Let's not only concentrate on the negatives at this regard, at this point in time. So the Carl Huchner patient that was at ICU has been transferred back to the Western Hill region because he has done fairly well. We are looking at the patient in Corozal and looking to see if there's conditions for that patient to also be transferred. Both patients, actually, the only two patients hospitalized, if they will have conditions at home that they can be taken care of without getting into further complications. Kits from Power to have arrived today. Have they arrived? We do have 2,500 reactions from PAHO. They're spending 11,500. I haven't checked today whether they have arrived. We were also trying to get some of the equipment in terms of ventilators and that in a flight that came in today. Flight with no passengers, I must say. It's a separate situation because cargo does come in, but I haven't checked today. So that's all I have for now. I want everybody to continue to remain engaged. The same principles remain: social distancing, washing of hands. If you're ill, don't be out in public. Call the number that we have given, 0800 MOH care. I know people say sometimes it gets clogged up, but that's because sometimes we get calls that have nothing to do with health-related issues. So thank you very much for all the support, and I think John will walk you through what we do with whenever we have any person that dies as a result of COVID-19, or anybody who is COVID-19 positive and dies for some other reason, which can happen, what we intend to do in that regard, again, based on international established guidelines.
Okay. Thank you very much, Doc, and pleasant good afternoon to one and all. And over the last 4 weeks, the Public Health Department has been engaged in many activities related to the protection of the general population from COVID-19. And in general, we have 4 specific areas that we focus on, and one of them was actually to draft the protocols for the management of deceased person with known or suspected COVID-19 case. And as you know, now that we have progressed in this emergency, we now have 2 deaths, and of course that triggered the need for the burial of those individuals. Primarily what happened in the management of these individuals are primarily the same approaches, but with some modification. For example, if an individual dies at this point in time, the body is placed directly into a body bag. So this is something different than what used to happen before. It would be taken down on the gurney to the morgue and then placed in the storage facility until they are ready to do the necessary processing of that body. So at this point in time, the individual will be bagged in a body bag and then taken to the morgue. And at that point in time, the body bag would then be disinfected thoroughly with a disinfectant, and normally it's bleach disinfectant, 1 in 100 or 1%. So the entire body bag would be disinfected. Immediately after that, it would be placed in a casket, and this is where there's a differentiation between what used to happen in the routine time and now in this emergency, because the body is then moved directly from that morgue table into the casket and then the casket is then disinfected as well, and then it's taken out for burial. Now, in terms of that procedure, it must be done immediately or as early as possible with very little interaction. And if you realize that we did not talk about any type of invasive procedures doing there, for example, any autopsy, and that is not really what is expected to be done in this, unless there is a coroner's case that will require that. But at this point in time, we know that the person died of COVID, and so there's an urgent need for us to now do the final disposal of the individual. And this can be done in two medium. It's either one by cremation or two by burial. Now, and this is an approach that is normally adopted in any emergency where there is many unknowns. And of course, you all know that this is a novel virus, and there are many things that are being found as it evolves. And so, as early as possible, if we could do the final disposal of the remains, it would be a better protection for the population. So, while some people might prefer cremation because the body can actually, or the ashes can be then used in terms of a funeral service later on after the event has done. Some people choose that, and in other cases, people choose to do the burial. Remember, these still require that there's a cost incurred by the public or for the families that are involved, and so whenever we have individuals, specifically when we talk about ICU, intensive care unit cases, we need to start doing the necessary planning to ensure that these bodies can be disposed of as early as possible. Of course, the variation in terms of prices is there. So, and of course, the price is actually done by the funeral homes that would be doing either the cremation or burial, and that would be according to the price that the funeral homes would have. Now, in terms of the management of these bodies, the standard precautions still exist for them or is recommended. In terms of PPE, there's a need for the protection of the eyes, so we use, and for the nose, so we do use the N95 mask, and we use gloves. We also recommend the long gongs or aprons, which is fluid resistant, to be used because when you apply the disinfection, they could be splashes, and so it's important that these are at all times being worn by the person managing the individuals. Okay. Okay, in terms of medication used to help relieve symptoms and to self-medicate at home would be basically medications that are normally over the counter or recommended by the hospital. So that would be medication that would be used at home. Are we considering deaths that appear normal, not related to COVID-19, but without us knowing may be COVID related? And that's why in terms of the protocol that was developed, it says either known or suspected. So these procedures will all be applied to those persons that are either COVID case or those that are suspected to be of COVID origin. So that's in regards to the management of the deceased persons. In fact, there is a related question that came up in relation to the management of dead bodies, and by virtue of the international health regulation, we are responsible to ensure that we issue the permits for the transfer of bodies internationally. And so we had to review our international requirements for the transportation of individuals. And so we looked at the the requirement, specifically for foreigners, and this is solely for individuals who might want to leave the country. But there are certain issues that we must look at when we talk about the death of individuals and or COVID specifically in relation to the movement internationally. And through IHR, it's recommended that we must put in place measures that would prohibit the spread of the illness. And as such, there are certain requirements that must be met. The first one is that the body must be embalmed, and we're not doing any invasive procedure, and we are not embalming the bodies, so that would not be able to be transported internationally. The second criteria is that now we don't have frequent cargo planes coming to the country for the transfer of these bodies, and so we don't know how quick these bodies would be able to leave the country. As such, the ministry, and based on the Quarantine Act and the need for urgent or early as possible disposal of these individuals, they have recommended that the bodies either be cremated or buried. So in regards to those people who might want to get the remains of their individuals transferred internationally, the only way it can be done if the body is cremated. Again, there will be no risk because of the high temperature through which the body burns. In terms of someone dies on Key Kaka, it says here, if someone dies on Key Kaka or Ambergris Key from COVID, can the body be transported to the mainland for cremation? Again, this would be a consideration we'd have to look into, but again, as we said, the issue in terms of movement is a risk that we have in terms of the spread of the virus, and so normally for containment purpose, it should be dealt with at the location. So that would be an issue unless we can avoid any possible transfer of the virus, then that might be considered. Can members view the body with PPEs on at least? And this has been considered or reviewed, and what we have found is that we are trying to control the amount of interaction between the individuals and bodies. In fact, we know that at funerals, very often people want to have some interactions with the body. And at times during the grieving process, it's hard to control these individuals, and we've seen that in a number of cases. In fact, even when we have the advisory that only limit the number of persons to the event or to a funeral should be 10 at the maximum, we still have a funeral that was conducted last weekend which had in excess of that amount of individuals. So there is it's a very hard thing to say that we can allow it while we can put on all the PPEs. Sometimes people cannot really control themselves when they see their loved ones, and so there is that issue we have to be very worried about in terms of people having interaction with the body itself. And it says, can you tell us more about the fumigation practice being conducted across the country and how these entities ensure that once fumigated, a place is safe for public use? In terms of the fumigation, and that's one of the areas that I wanted to bring to the forefront today, because there has been a number of disinfection that has, or sanitization that has been happening across the country. And for the most part, I believe that people are trying to do good, but there are still some gaps that needs to be covered in terms of the safety for these individuals. I think one of the first things that we need to look at is the following of the manufacturer's instruction for all cleaning and disinfection. For example, The concentration, we know that in some of the reports we've seen that people are using as high as 10% solution in terms of bleach. And again, that is not what is recommended. A 1% solution is what is recommended. And what we do have is that we have individuals that are using these disinfectants, and they are now being exposed, or their skins are being exposed to these high concentration, which could cause breaks after prolonged use. Now, this would be perfect in terms of creating other issues. For example, after the skin cracks, the interaction with other surfaces, you might have other germs that goes in there and create other illnesses. So we need to ensure that, first of all, the concentration is appropriate as recommended, and also it must be for the type of surfaces that we have. Is it hard surfaces that it's made to be applied to? Is it soft surfaces? And also, we need to look at something that is very important, which relates to how do we know that the procedure was safe, or the procedure was complete. And it relates to the contact time. In terms of bleach, the recommended contact time is 10 minutes, and once that 10 minutes is adhered to, then the place would be safe for anybody to actually return to that location. And so it's important for any individuals who would be using any disinfectant that the concentration must be maintained. The method for application, again, must be maintained, as well as the contact time. We also need to reiterate the adherence to the safety precautions. Anyone conducting the disinfection process should be well outfitted with the necessary PPE. So it means that they must be wearing gloves if required. They need to be using overalls. In some of the cases, we saw people using raincoats. Of course, those have areas where you could have intrusion, and so the chemicals can definitely make entrance and contact with the body. Of course, we need to ensure that when we use the PPEs, that they are well used and they are protected properly, protecting the body properly. So those are conditions that we need to ensure that people adhere to whenever they're doing the spraying. Now, I know, again, people have been doing their own processes in terms of application. And what we are seeing is that they're using either compressed air or water or chemicals under pressure. And of course, for COVID-19, this is not one of the best methods for application, because if you have the virus lodged onto a surface, and upon the contact of that pressurized chemical, then you start having splashes, and we tend to then get that moving from one location to the other, and then it would not be a good disinfection process that really occurs. Most appropriate for this situation would be the use of fumes, and so it would get into all the cracks and crevices, and there will be no displacement of the virus across any room or surfaces as you apply it. So that would be the recommended mechanism for disinfection. So we want to, as much as possible, when we apply the chemicals, to have as little dispersion or suspension of the virus within the air or within the area that we're cleaning. So those would be our recommendation. In regards to to other ongoing activities that we have been engaged to ensure that we can strengthen the response, we have been training individuals from, we had trained individuals from Red Cross and community health workers in 3 locations in Belize. We have Belmopan and in San Ignacio. And these trainings were conducted by myself. We had Dr. Polanco from the Pan American Health Organization, and we have Mr. Emmanuel from the Licensing and Accreditation unit, which is responsible for infection prevention and control. And we had these trainings for these individuals to support us as volunteers in terms of the management of quarantine facilities in the different districts. Now, in terms of the assistance that they would be providing, these individuals would not have any contact with these individuals that are in the quarantine facilities, and the quarantine facilities are basically areas where people would have not had the ability to actually isolate themselves. So they are not at home. So they are not individuals that are positive, but individuals that were unable to isolate themselves home and needed somewhere, and that was provided as a social area for them to actually isolate themselves. So the individuals who would be volunteers for these places would assist us in terms of activities such like documenting the individuals in the facility and general observation of these people during the day and the time that they are there. So these individuals will have no direct contact. In fact, where they would be in order to observe the individuals would be in a separate room, but have clear observation because the quarantine areas are normally open spaces. So things like ensuring that they're not engaging in any kind of group activity in the quarantine facility, and maintaining social distancing and ensuring that they have the necessary food, water, and other supplies that they do need while they're in those places. So these individuals were trained in terms of basic IPC with gloves and masks, which would be the two PPEs that are important for them. So they were trained in terms of the use of gloves and masks, and their role as it relates to assistance within the context of a health emergency response. We also focus in terms of the communication and coordination mechanism of the Ministry of Health, because it has a tier system. As we speak about the Emergency Operations Center, we have one at the national level, as well as we have emergency operations centers at the district level, whereby information is channeled to and from different levels. So we provided them with the type of information that they would have access to in terms of important numbers, telephone numbers for these individuals or for these facilities that they would need to make calls to. As we continue in terms of this emergency, I think that we still need to reflect in terms, even at the household level, what we do in regards to household cleaners. And we would like to put out there that while we do recommend the use of bleach, we know that some people like to add various other disinfectants to them, and bleach in itself should be used alone. And when you start using it with other chemicals, you start having many type of toxic gases being produced, and this you could always smell it whenever it's interacting with the chlorine. So we don't want that to be in the homes at the moment. So if we're using bleach, it needs to be used alone. Remember, we're in smaller confined areas as we speak in terms of COVID, and we need to ensure that the air remains as pure as possible. We have a question that says, Channel 7 aired the burial of case 10. Will that be a standard practice given taken some issue with the ethics of such practice? Of course, there are some, it's not only ethnic but cultural practice that I did not really see that document in regards to the ethnic and cultural practices that was related. But as much as possible, we need to ensure that any kind of contact with the body is minimized. This is, of course, to prevent any contact with the virus itself. So we limit it to 10, and of course, the 10 persons that attend the funeral, of course, you would have the officiant of that funeral. If at this time they see it as a need, because some people are deciding to record it and make this then available for them at the burial site. But of course, a lot of the cultural aspect of what we're accustomed to doing in terms of funerals will need to change. So in terms of these individuals, we are asking that whenever they have funerals, that there is no contact with them, and it is kept to a minimum in terms of the group number. We have, in terms of engaging, in terms of the surveillance system, and we know that the public health inspectors, the doctors, and the other persons of the surveillance teams are out in the public, and they are doing their on-the-ground investigation. I would just like to remind individuals that we continue to ask for your cooperation in terms of providing accurate information. In some cases, we still have people who are very much unwilling to provide all the details, and we're not talking about personal detail, but the contact information that is required to determine whether we need to actually conduct that test on the individual. In regards to the Quarantine Act, Chapter 41, it clearly states that any person placed under observation or surveillance shall furnish all information as being reasonable, required by the health officers. And so we ask that you, as they conduct their surveillance in the community, that you continue to provide as much information as you can recall, because it will help us in terms of making that mapping activity easier, and we can actually find those cases that may be asymptomatic. And this is one of the things that we really need to find, because the persons who are not showing signs can be very well the persons who are circulating the illness in the country, and we need to actually be able to identify and isolate these individuals as required. As we continue this event here, I think a lot of people have the idea that this is the responsibility of solely the Ministry of Health. Actually, I was on the web, and I found a very nice poster, and it says that not all heroes wear capes. And I believe that in most of the movies that we've seen on the television, people always foresee that, some superhero will come along and do it for us. Unfortunately, that is in the movies. And we need to all be a part of the solution to this problem. And the people who are the persons wearing the cape are everybody. So we want to especially thank those people in the medical sector who are out there, but we also need to thank the general community who is adhering to the recommendations are provided for them, especially in terms of social distancing. That will make a big difference in terms of how early we can actually move from this situation and return to whatever would be considered to be a normal situation later in this event. So we ask you to continue to practice hand hygiene. The washing is important, and remember, while we do have sanitizers, we need to wash before we can do the sanitization, or else it will not be effective. We have 2 more questions here. It says, how long after dying does the virus survive on the cadaver? That still has not been identified, and as such, that's why there's a disinfection process that is actually applied to the exterior of the body bag as well as to the coffin, to ensure that if any escape, it will be killed by the disinfectant. Can you speak to vinegar being an alternate in some instances to using bleach? Well, there are various things, and if you look at the EPA, the Environmental Protection Agency in the US, there are many variations of products that can be used in regards in relation to interchangeable with others. So we're talking about interchangeable with bleach. I don't think that I have seen any that speaks to vinegar directly, but acetic, which could be considered the same, would of course could be used. Of course, we need to know at what concentration the vinegar is. So for your basic sanitization at home, it can be used. In terms of its effectiveness, would be based on the level of concentration. So that can still be used, but of course, that would be just for the general sanitization at home. But we need to know the concentration at which you're using those disinfectants. We just before we wrap up, I think we need to start doing or taking some additional measures, I would call them, in terms of ensuring that we can safely exit this event here. And I also have another page that I extracted from the internet, which it says to slow it down. And slow it down because very often we are very much in haste and a rush to do many things. And even in terms of when we're asking you to wash your hands, we need to ensure that you spend that 20 seconds washing your hands. We also need to ask you to slow it down. I noticed that that we have a lot of gathering happening whenever people are going for the foods which are being distributed by the pantry. We need to still maintain our distance 3 feet away from each other. If we're coughing, we still must remember that we're supposed to cover it, and of course you do it in your sleeve, and if you don't have a sleeve, then you could always lift your shirt to capture any of the coughing that is coming out. And then avoid group gathering. We still see some interactions there, and again, depending on how much we adhere to the recommendation will actually determine how early we actually exit this emergency. So we need to avoid those group gatherings. It says do our part. Of course, avoid travel, and we still see some people on the road moving from one location to the next. And of course, if they're asymptomatic, these people can be carriers of the disease from one location to the others. And we also want to discourage visitors. I know of some instances where people are still visiting homes to pay a little visit to their long friend that they haven't seen. This is not the time or place to do it. Of course, we might look healthy, but we don't know. People can be carriers, and so we need to ensure that we discourage people from visiting us during this time. Shop thoughtfully. Again, the recommendation has been made that we need to ensure that we have a list, and if practical as possible, if we could have only one person that goes out to do the shopping and do that interaction, we definitely would minimize the amount of interaction and the possibility of introducing it at home. Stay home if you feel sick. Again, we have not been seeing or receiving reports of many people having flu-like symptoms, which is a positive thing. But if you do feel ill, we still would ask you to stay at home. And of course, in closing, we want to remind you to be kind. What we do to any one of our brothers or sisters out there must be with a gesture of kindness. Share some food if we have excess. There are many people who might not have and just is in need of food, and we just need to think of it as another good deed that we're performing. And this will take us a long way in terms of coming out of this event as a community, one that has survived and surmounted COVID-19. So we'd like to thank you for joining us in this episode, and as per usual, we will be seeing you in the next segment. Thank you.
In response to COVID-19, the government of Belize has implemented strict guidelines